ब्रेस्ट एनहांसमेंट विद इम्प्लांट्स आजकल बहुत फीमेल्स कराती हैं एंड इट इज़ अ वेरी कॉमन प्रोसीजर। जितना कॉमन ये प्रोसीजर है और उतना ही इम्पॉर्टेंट उसका एक रिकवरी फेज भी होता है। सो आज आई विल डिस्कस अबाउट द रिकवरी फेज, व्हाट आर द डूज एंड डोंट्स यू नीड टू नो during the recovery phase, what you should expect out of surgery, and what is the timeline for the recovery phases, so that if you are planning for a breast augmentation, आप पहले से prepared हो, aware हो कि आपको breast augmentation के बाद क्या क्या फेस करना पड़ सकता है, and you are more prepared for the surgery. So hello friends, I am Dr. Diksha Dixit, cosmetic and plastic surgeon at GK1 in New Delhi and co-founder of the Aesculpir clinic. So today I will go step by step of how to proceed with breast augmentation after surgery. So पहले हम general precautions या general routine की बात करेंगे जो you have to follow after breast augmentation with implants or after any major plastic surgery procedures. So general में ये आता है you need to sleep well. If we are talking about implants, you need to sleep on your back. You should not be sleeping on your stomach. You can take side turns in between, but not for long. You should sleep well. Apart from that, you should eat well, eat healthy, because fast food and any other junk food might delay or hamper your healing process. Then you have to avoid weightlifting for some time, lifting your normal routines, heavy objects, and swimming for some time. You have to avoid smoking for a minimum of 4 weeks post procedure, because it will definitely hamper in your final results and your recovery and healing phase. If you can avoid alcohol for a minimum of 2 weeks, that is really great. इसके अलावा you need to be under proper follow-up with your expert so that he or she knows what action has to be taken if at all there are certain kind of alarming or warning signals. ये तो बात हुई general precautions या general care which you should take after the procedure. Now special mention about breast augmentation with implants में हम सबसे पहले बात करते हैं recovery timelines की. What you should expect at each step of your recovery. So on post-op day 1, you will expect pain, dizziness and soreness in your chest area and heaviness of your chest. So this pain and dizziness might hamper you in doing your normal routine. So it is important you have an attendant with you so that he or she can help you go home, drive you home back, and can help you in your daily work. For first 3 days, you will have chest discomfort, you will feel heaviness in your chest, you will have swelling, you will have bruising. So for that time, please take your medicines on time as prescribed by your surgeon, take proper rest, keep yourself properly hydrated. The showering is to be taken after 48 hours, and you have to keep your incision lines healthy and clean by removing the gauzes daily and cleaning that part and applying the antibiotic ointment prescribed by your clinician or your expert. After 3 days, what you expect in first 2 weeks? First 2 weeks, you will have gradual decrease in your swelling and you can resume your normal work activities. But you have to avoid any kind of strenuous exercises, chiefly your upper body exercises. Any kind of strenuous work is to be avoided. And you have to wear a supportive bra with a chest band which your clinician, your expert advises you. The underwire bra is not to be worn during that time. From 3 weeks to 6 weeks, you will see an enhanced increase in your daily activity. You will feel more comfortable day by day, and your healing process will be majorly complete by that time. Your internal healing would be good. You can resume your normal work. Still, you have to be under constant follow-up with your expert plastic surgeon so that he or she can advise you as to what during that period you need to start your exercises with. Please don't start your extreme heavy weightlifting exercises in one go after 3 weeks. Please make it gradual under the guidance of your expert. So beyond 6 weeks, we expect that you shift from your supportive bra to your underwire bra, and you can resume your exercises in a gradual increased potential manner. These are the basic recovery timelines. Now there are many patients who ask us about three main questions. One is massaging, one is intimate physical contact with the person, and third and most important is the exercise, because usually these patients come in the category of very fit patients who are very fit in terms of exercise, very strict with their diet and have a healthy lifestyle and are very conscious about their image. So the exercise is one question which we need to keep in mind before we go for these surgeries, and you plan your surgeries beforehand. Massaging, if we talk about massaging, the massaging is at the discretion of your surgeon to advise you or not. So please follow the advice of your surgeon as per the massaging part. If we come to intimate physical contact, we as plastic surgeon tell the patient to avoid physical contact for about 3 weeks for proper healing during that phase, and so as to avoid any kind of rupture, any kind of displacement of your implant during that phase. Now comes the very important part, is the post-procedure exercise, when to follow, when to not. For about 4 weeks, you are not supposed to do any core exercises, any upper body exercises, any high intensity workout is to be avoided. On the first week or after first week, you can start with your normal walking, you can start treadmill walking, you can start your stationary bikes. From 2 to 3 weeks, you can gradually increase your walking exercises. After 3 weeks, you can start your light jogging and your HIIT training gradually under the supervision of your expert. But upper body weightlifting is to be avoided. Beyond 6 weeks, you can start your upper body exercises in a gradual manner. The lower body exercises, we usually advise the patients to start from 3 weeks, starting from lower body weights or from your lunges and squats, and gradually increasing them by increasing the body weights, and that has to be under the supervision of your expert, so he or she knows that your implant is healed well, is in place well, and is not displaced, ruptured, or any kind of side effect which might happen with exercises happening. So a proper follow-up with your experts for at least 6 months is mandatory, and that is what we advise our patients to do. Hope you find this video helpful and I am able to clear your doubts. So if you are wanting to undergo a breast augmentation with implants beforehand, you're well aware of how to be prepared mentally and physically for the same. If you have any further queries regarding augmentation with implants or any other related queries of plastic surgery, please feel free to write to us. You can follow our YouTube channel by the name of the Aesculpir and be updated with further videos. You can also follow our Instagram handle by the name of the_Aesculpir, or you can directly contact us on our given numbers. Thank you.